I really want to just take a moment to say it's exciting to see what's happening on LinkedIn and everyone sharing what they're doing. So please share here in the chat what you're doing for Healthcare Simulation Week, as well as sharing it or reposting other activities that are happening as far as Healthcare Simulation Week. We really do need to celebrate this and share what we do as a profession. I think it's really one of the very few professions that started off as an international and interdisciplinary profession, and I'm very proud to be a simulationist, and I'm sure you are as well. Today I have the honor to introduce Lioce, and I hope I didn't butcher your last name, Lori. You say it a little differently than I do, so I know I'm probably saying it quite a little bit incorrectly, but I want to spend a few minutes just introducing who she is and what she's going to be sharing with us today. One thing to, again, note is that this is going to be interactive, so please put any questions that you have in the chat, and we'll talk to Lori after it's over and ask her those questions. I know I've had a chance to have a sneak peek, so I already have some questions prepared, but we do want to hear from you, and Lori will be happy to answer any questions that you have at the end of this. So Laura, let's talk a little bit about Lori so you kind of have a context for who she is. She's a clinical professor and an executive director of Learning and Technology Resource of the Learning and Technology Resource Center at the University of Alabama in Huntsville College of Nursing. She's an AACN board certified family nurse practitioner, a fellow of the American Association of Nurse Practitioners, and a fellow of the American Academy of Nursing. As an experienced academician, oh boy, I can't say that correctly today. Lori, I'm sorry, I'm butchering that.
I'm just a professor. I'm a professor.
Professor and clinician, Dr. Lioce has an exceptional career as a pioneer in simulation education with international certifications as an advanced certified healthcare simulation educator, which is one of only 83 in the world, as far as I know, and a certified healthcare simulation operations specialist. She has sustained scholarly contributions with over 50 international presentations and 60 publications, which have been used to advance healthcare simulation education globally through her seminal, enduring, and collaborative work in setting international best practices for standards for simulation simulation-based education and research in standardizing terminology used by simulationists. And again, we're going to be talking today about that, standardizing simulation, the terminology, because it's so important in what we do in our profession and how we disseminate the work. Lori has over 30 years of highly engaged service in the healthcare professions and specializes in simulation operations, curriculum development and implementation, strategic planning, faculty development, simulation design, and programmatic quality improvement. She has received 30 honors and awards, including teaching service commendations from the legislature. Wow, from the legislature, Lori, that's cool, for her contributions, as well as the Living Legacy Award from Stanford University. Lori serves on the Huntsville Hospital Foundation Board of Trustees and is the editor for the Healthcare Simulation Dictionary for the Society for Simulation in Healthcare. Dr. Lioce earned her BSN and MSN in Nursing Administration and Postmaster's Family Nurse Practitioner Certificate from the University of Alabama, Huntsville, and her Doctor of Nursing Practice from Stanford University. So welcome, Lori. Thank you for sharing what you have, and we will get right to that recording so you guys can take a look at it. And then again, please put your questions in the chat so we can address them afterwards.
Curtis, I don't hear audio.
Yeah, I think the audio is not sharing.
Practitioner and clinical professor at the University of Alabama in Huntsville College of Nursing. I run the Learning and Technology Resource Center and have been in simulation, gosh, I think 15, 16 years now. So as well as being a nurse for almost 30. Gosh, that's telling my age. Anyways, what I have learned over these last 9.5 years, I've been involved with the terminology working group since 2012, is that our words matter, right? And they matter differently than I thought they did 10 years ago. And so every year working with this group, I have just learned so much from other experts, but especially with the move towards standardization of simulation and standards, as well as best practices that come out. Our move towards outcome measurement has been super important. Our interprofessional collaboration is much better when we have a common language. So I just wanted to share a little terminology talk, maybe over a cup of tea for a few minutes, to celebrate Healthcare Simulation Week and tell you why it's important and how you can be involved. All of those things really bounce around a couple of topics. What is the Healthcare Simulation Dictionary? Formally, I can tell you it features a collection of definitions showing how various terms and their meanings are being used really in our profession today. Where did it come from is usually the second question I get asked, and this is a longer answer probably, but it really came from a longstanding desire of the Society for Simulation in Healthcare. Given the real rapid pace of expansion among healthcare simulation operations, research, policies, common definitions of terms used for the profession was really needed, especially given the international expansion and interprofessional collaboration happening. So in 2013, a working group was formed and charged with the creation of a dictionary. That group recognized a need to compile terms that had been completed by other groups in healthcare simulation and to add more terms that were needed to kind of standardize it. The Healthcare Simulation Dictionary really represents the work of many individuals and their societies to refine that dictionary and refine the glossaries that existed. The goal of the dictionary really continues to be enhancing communication and clarity for healthcare simulation in teaching, education, assessment, research, and systems integration activities. Those obviously align with the accreditation as well, accreditation standards from SSH. And we really deeply value the vision by our past president of the society, Dr. Joseph Lopriato, in developing and garnering the support of the Agency for Healthcare Research and Quality to partner with the society in healthcare and all of its affiliates to produce that comprehensive healthcare simulation dictionary and disseminate it widely as part of both SSH's and AHRQ's mission to improve patient safety, which includes simulation research, right? So that we can continue those missions. One of our challenges is that many papers, articles, and policy statements used so many different terms to describe similar phenomena without really explaining those or using them consistently. So the lack of consistency of using the terms was a real limiting factor for scientific study of the discipline and limited our ability to replicate or advance healthcare simulation over multiple settings. So the Society for Simulation Healthcare convened a task force in January 2013 at IMSH to organize, plan, and conduct the vision for the dictionary and to help enlisted the help of other simulation societies around the world. So last year, Anderson 2020, and then a few years before that, Franklin et al. 2015 stated that the misuse of language or a failure to ensure disciplined and consistent choices in the selection of terms really delayed, misdirected, and generalized research findings. So it was hard to replicate those. So I want to give you a little background. I get asked questions all the time. How do you do it? And really, what's the process? So we started by identifying two things. Who is the dictionary for? So it's primarily written to assist individuals and institutions involved with conducting or administering and researching simulation across the healthcare setting. So it's for any of those individuals or institutions involved with those things. And what is it used for? Mostly for individuals or institutions needing a common understanding of a word used in the field of healthcare simulation to educate individuals, assist in writing about healthcare simulation, and or advancing scholarly research. So once we knew those two things, the task force established some early ground rules to really guide the development of the work. This is the process part. This is the part that most people want to know how we do it. So in particular, the focus was defining concepts that may have several definitions instead of just relying on one definition for the majority of the terms, because they weren't applicable across every setting. So this was in recognition of the fact that internationally, similar concepts also have different words or different definitions. And by defining the concept, the dictionary would be more useful in many more contexts and across many more fields. So another key point to note is that the Healthcare Simulation Dictionary would seek to define terms found in literature, but would never dictate the definition of a term. it would give you choices and clearly show you what was reflected in the literature. And I think that's the biggest part that most people are surprised at. We're not leading it. We are actually reflecting what's there for you so that it may be used properly or thoughtfully. So also, if there's several different spellings of a term, one of the most frequent is mannequin, M-A-N-I-K-I-N, or mannequin, M-A-N-N-E-Q-I-N, that the healthcare simulation would just reflect that there are multiple spellings, but not try and tell you which one to use or impose those terms on the field. It just gave you choices. So it clearly reflects the literature in whole without being deferential to any particular term or definition. So lastly, the healthcare simulation dictionary, it's important to point out that it's a living document. So it has additions and corrections that are added or removed as their usage in the literature changes or it's deleted. So the group really worked in 3 phases. Initially in January 2013, the first phase was to gather the documents from all the various sources that have produced simulation terms of references or glossaries. We assembled into working groups from individuals interested in helping to representatives from those organizations that also had donated and allowed their glossaries to be used. So we also engaged a lexicographer and gathered insight into the lexicographic process. And that was really important as well, because we're not experts in lexicography. For sure. Phase 2 really began in January 2014. This was a long process, obviously, working with all the different organizations, but began research and editing of the initial master list of terms, deleted duplicates, and any terms that weren't really applicable to healthcare simulation. Maybe they were more defining education and it already existed, but we really wanted healthcare simulation terms. And then it began writing definitions according to a style guide. We have a style guide that really helps us look at each of those things, each term individually, and keep some consistency all the way through it. And Andrew Spain was a vital part of that process as well. He was the staff support as well as a leader of the group and specializes in this as well. But we conducted focus groups of SSH members to assess needs and we kept our affiliate societies informed of the progress and participatory in the process as well. Phase 3 really started in January 2015, and that was a secondary review of terms for clarity, style, as we went through. The review of terms included simulation societies in a world tour, basically, where we gathered reps for consensus conference. And then we analyzed what we had, organized and refined the data, and then expanded into other documents and gathered further resources and finalized that list of terms to publish. And that original publication was 2016. We have the Healthcare Simulation Dictionary. Fast forward a little bit, the Terminology and Concepts Working Group employed a real deliberate approach in choosing those terms and definitions that appear in there. And it's not an easy task. It's very complex in the variety of terms used in the literature and the writing teams that were necessary to make that happen. But the style guide, developed in consultation with that consultant lexicographer, who, by the way, is a specialist in the creation of dictionary terms, standardized the ways they were to be used in the dictionary. So it was established according to that consultant's recommendations and included specific elements. We have the head word, spelling variants, parts of speech, pronunciation, etymology, definitions, examples of how the word's used, as well as related words or sources from where they came from, so that you can go back and dig in deeper if you're really looking into words deeply. So each team cataloged those, cataloged the references, also looked into what had been published by some simulation societies around the world, the accrediting bodies, and other organizations such as ASPE, the Association for Standardized Patient Educators, the International Nursing Association for Clinical Simulation and Learning, the Interprofessional Education Symposium, the American Association of Medical Colleges, and the U.S. Department of Defense Modeling and Simulation Glossaries, as well as the Journal for Simulation and Healthcare. Those glossaries and literature really provided a robust prioritized list that started from that we could curate and expand into evolving the dictionary. So there were reference lists included there, and the task force really felt that in order to define the concepts, a good starting place would be to review the origin of the terms in the English language. So the society then invested in an etymologist employed to really derive the origin of each word so that we knew where they came from and how they were originally intended to be used, which gave some depth to those terms as well. So once all those were compiled, we eliminated terms that were more educational design. We wanted to make sure if they were already well defined in existing dictionary, and if they weren't healthcare focused, they were eliminated. And many of the words previously published did not always include reference sources, so we needed to make sure they were really reflected in the literature. And that's where each reviewer was tasked with finding published references for the terms being defined, and then linking the term to its usage in the reference that was cited. So while it was a lot of laborious work and many hours of labor, it really gave us the proper context in which to place the term. So I really would be remiss if we didn't do a shout out to the full interprofessional team that is involved today, even Dr. Joe Lopriato, who fathered and fostered this idea and led the 2016 inaugural publication, as well as enlisting the support of AHRQ, as we mentioned before. But it's also important to thank the volunteers who came from the task force for from several United States simulation societies and from 16 societies around the world. That would not be possible without that teamwork that happened from 2012 to 2016 for sure. Now we fast forward 4 years and we have a shout out to our team associate editors. So for version 2.0, which came out January 2020, and that's Todd Chang, Mindy Anderson, Desiree Diaz, Jamie Robertson, Andrew Spain, Dana Downing, and of course, Dr. Lopriato. So we published the Healthcare Simulation Dictionary in January 2020, as we mentioned. As usual, there's a full terminology and working concept group that gets a huge shout out. Can't mention them all in this short presentation, but the terminology and concepts working group still exists, and it is a robust group, and we meet every year at IMSH. So if that's something you're interested in doing, we would love to hear from you. And at the end, I'll give my email, so grab a pen. But the pandemic happened right after we did the second edition. And so in response to the pandemic and political climate changes, we did a just-in-time revision as well for Healthcare Simulation Week last year, which was amazing. But the second edition from 2016 to 2020 expanded on the 127 words that were in there, as well as added 27 abbreviations. We didn't have abbreviations in there, and we know we all love our acronyms. So there are 27 of the most common abbreviations used. We added 40 new terms that were not in the first edition, and 12 terms were expanded with additional definitions that were reflected in the literature. So the working group also produced an article last year during the pandemic toward defining healthcare simulation escape rooms, which was published in Simulation and Gaming and led by Dr. Anderson, myself, Robertson, Lopriato, and Diaz. And it was published in 2020, but because the word escape rooms was being used in so many different ways, again, we just reflected what the literature said and provided some guidance there. So really, I mean, the whole thing comes down to why does all this matter? I know, but we need your input to standardize the language, to really choose the words carefully as we publish and put things out there, because it is informative for the dictionary work, and to provide info on how you're practicing and what you're seeing in the literature. Our next steps will be trying to get you involved as well. Do you have a word we should consider for the next edition of the Healthcare Simulation Dictionary? You can go to ssh.org and /dictionary. You can look on that page. There is a button there where you can submit a word and provide a reference for that word. Obviously, you know that that's going to be important to us, and a definition of how it's used. So the references and definitions are important. Or if you look at something in the dictionary and you find that it needs revising, you can submit that there as well. Or if there's another reference that we can add to the word, or another definition to expand the word, we really like doing that. You can also recommend any acronyms that need to be in there, abbreviations. So anything you can do to help us expand it, we'll do the research on it and hopefully be able to get that added. One other thing to bring your attention to is that on the website, we have multiple languages of the dictionary. So there are 8 languages on the dictionary, which have, I don't know, just delighted us as we move forward. We love partnering with people. So if you speak a different language or have a group of people that would like to provide version 2.1, we need your help with translations. We currently have many. We have let's see, Italian, we have Japanese, Chinese, Spanish, we have German, Turkish, Hebrew, and Russian. So 8 languages, which is amazing. And you can print your own copy of the dictionary off on the Society for Simulation and Healthcare Dictionaries webpage. Just type it in, Google it, you'll find it. You can print a current copy of 2.1 and any of the languages you need. So I hope this has been helpful. If you want to help with translations or words, please send me an email, lioce@gmail.com. That's LORILIOCE@gmail.com. We'd love to work with you. I also want to extend one special invitation to IMSH 2022, which is live in LA again this year. So super excited about that. It's an amazing place to be. We will be having a panel presentation for hot terms and terminology in healthcare simulation. So the panel presentation will be live. If there's a term that you want us to debate, we're going to be debating it with our panels and talking about uses and proper and improper, which so people have all kinds of opinions, and what we're going to do is look at the way it's done. But if there's a term you want to talk about, we are happy to talk about it. So again, just get into contact with me, and coming live from you from Alabama. I'm signing out. Happy Healthcare Simulation Week 2022. Hopefully we'll get to see you in LA. Bye.
Thanks, Lori, so much for putting that together for us and really, again, giving us some insight into, how the dictionary was started. And I'm wondering, again, I know that you were also on some of the standards of best writing with standards of best practice for an Axle. So was it happening in parallel? Was this dictionary, the initiation kind of happening in parallel with the standards?
Yeah, absolutely. So I think originally my first introduction to even the glossaries, like in 2012, we were working on updating the in Axle 2011 standards of best practice. And that first one was a glossary terminology, right, that we started with. And that's what really got me into terminology at all and trying to figure out those words and what they meant. And then when SSH undertook that, I was an Axle's representative to that working group. And that's really how we started with Carol Fowler Durham, and Barbara Sittner's on here. I think she came in with us too, and some of that work and some of the workshops at IMSH. But yeah, when SSH decided to take it up, it was a much needed project. Everybody was developing their own. There was not one common place to find them. Everybody's varied a little bit, and so we knew that to measure outcomes, we were going to have words that we could depend on, and that no matter which word you used, if we looked at a study, that it would absolutely represent exactly what happened. And so yeah, over that long process, yeah, it was part of as we worked with best practices and updated them and started looking them up. That's really how it evolved for me. SSH had Dr. Lopriato had a great vision of doing this long before I met him, right? Like long before I was involved with SSH. I think I became involved in SSH in about 2011, and then my work through an Axle did lead to the interaction to start. Yeah, but just volunteering because we were, like minds and common work.
Yeah, it's again, I can't tell you how I actually personally enjoyed the second edition much more because it has so much more information on standardized patients, which is my area of expertise and what I love doing. And I remember when the first one came out, I went to Joe and I'm like, people are defining this differently, and we need to get a common language. And we actually published an article on it between the first and second edition saying, hey, everybody needs to include a common lexicon, because with our research and when we're trying to find bodies of research, we all are using different terms and different words. I had no idea that in Europe that they were commonly using simulated patient instead of standardized patient. So for a while I was missing a whole body of literature. So again, I really was excited to see that second edition come out. Can you talk a little bit about what article you recently published? I guess I'm assuming secondary to the pandemic. It was kind of a quick, from what I can tell from what you had shared with us.
Yeah, I mean, I can tell you a little bit about it. So it's in simulation and gaming, and a special edition that Desiree Diaz did. And I know she's one of our, shout out to Des. She's I know coordinating a lot of this today and on the call. But But they did a simulation gaming issue on escape rooms. And one of the most common things we were seeing between the publication January 2020 of the dictionary, we had not put escape rooms in there. And we really hadn't thought a lot about it, but everybody was calling everything they did an escape room. And it was an opportunity to clarify the need for describing it and not just naming your new activity or your new online activity, and everybody was calling it a simulation escape room, but there may not have been anything simulated in it. And so for us, it got really fascinating, but there was also like, hey, is anybody going to say anything about this? How are we going to do this? All these new little studies and pilot studies and everything were coming out. And so yeah, it was really a unique opportunity to not dictate how it was, but publicize what some of the terms are. And we talked about many of the technical terms, virtual reality. There's many terms that were updated for that edition along with that. And they are on the website. I did put the website in the chat. Somebody asked for us to put that in the chat. So I put it in there for the dictionary, and you can go there and take a look at those and look at the updated edition as well as those translated editions.
Yeah, I will say at the University of Delaware, we published an article on what we were doing as part of the pandemic and the transition to a virtual format. And I was calling it virtual simulation. And what the comments from the editors was, this isn't virtual simulation, it's not avatars, because we were integrating SPs into our clinical group learning experiences. So they asked us to change the terminology to web-based simulation. So some of it is dictated by the articles that you publish in the literature, but it was just interesting to me to that they were saying, no, that's not what this is. And again, you kind of come at it from your own frame, so I could see how things go off the rails pretty quickly, and how that healthcare dictionary and again, the subsequent article are going to help to keep us uniformly connected. The other thing that I will say is I didn't know that there was an opportunity for us to kind of submit our opinions or thoughts on things. Is that something that's new, or is it just something that I've missed along the way in learning?
I don't know the actual year that it was put in place, but when we published the 2016, I know that we had there were some terms there. I don't think it was used very much. We started really making it more public, telling people about it at conferences and things, probably in 2016. But yeah, it's been around for a little bit. We get some traffic on that site, especially people that are passionate about certain words and don't like what's in the dictionary, or they've created their own word. But our thing is, so for the dictionary, because we're reflecting what's in the literature, even if it's a new definition, we have to find references to support that it's been used that way. It's not that we can just publish our own words and tell everybody to use it that way, or cite yourself. But it's really a reflection of what's in the literature. So it's kind of been fun. But people will run across new definitions or different definitions, just like you were saying. So if certain editors or reviewers are saying, "Hey, I want you to use this term," it'll be out there more and more. So I would even tell you submit that and web-based, unless we can take a look at that definition that they asked you to use and make sure that it is reflected as one of your options in clarifying the difference between web-based and virtual, and just distance education with something you're doing on site, or it's so different. And then so many of us are calling it telehealth, right? We're mocking up telehealth visits now with SP at home since COVID. So I am sure we're going to see a lot of different definitions as everybody publishes their work over these next years, and some differentiations in how they're used.
Yeah, and I know Healthy Sim has used the term telesimulation.
Yes.
So, there's also those types of things. Again, I think it's a great concept. And I guess it would encourage us that are here today that if we do have a new term that we'd like to use, that we publish on that, right?
Absolutely.
And utilizing that term, because it does help to, again, build the body of literature and to really support what we're doing. I think a big one for me, again, I don't want to take up too much of your time because there's not a lot of other questions, but for me, I have one more question at least. The idea of fidelity, there's a lot of different terms, environmental fidelity, psychological fidelity, physical fidelity, and some of them overlap and some of them are very different. How did you guys differentiate that? I know you said you stuck to the body of literature, but some of them, they don't quite match up. So how did you, if they didn't quite match up, what did you end up doing as far as deciding where there was an issue?
Yeah, we really don't make a decision. What we do is, if there's a citation for it, we provide each of the definitions and you get to decide how you use it. But as long as you're using one of the definitions, in there, that's what we would say, like find the definition, use it consistently. It will probably change the more, as some words phase in and out, but if it was cited properly, in a study with the background. But I would tell you that, the best way, obviously, with concept terminology, somebody just do a concept analysis, right? And it's a quick little 2 or 3 page publication. There's a process for it. And it sure makes it easier because people go find that makes it really easy to add the definition.
Right.
And it is much needed in a lot of what we're doing. There's so many terms thrown around in different ways. We're doing one now that we're hoping that'll, not the team, but individually at my school, we're trying to do a couple of concept analysis because it's just not clear. And our job is not to be the authority on it or dictate it, like I said, but it is to help provide a resource for finding out without you having to do all the research yourself, right? Finding out what term did I use here and what's the difference. And so there are a couple of more analysis that we did last year over, telesimulation and some of those, and what tele means and what simulation means. And so those hopefully will be in the next edition. And we really just, we don't have a timeline for the next editions. The more submissions we get, the more terms that are asked to look at, the more our group will get together and work. And so we do it based off the needs of the society and the literature as we see terms come up. So at IMSH, when we do the hot topics terminology panel, I'm sure we'll be debating, briefing or pre-briefing or debriefing, all those fun ones that everybody has an opinion on. But it will also probably yield some things that we need to do in the coming year and for the next update.
Right. So I'm going to just give a pregnant pause here and see if anybody wants to unmute and ask some questions. While they're doing that, Lori, could you put your email in the chat? Someone did ask for that as well.
Yeah.
And then we will see if there's any more questions. If not, I do have a little intro to what we're going to be talking about tonight at 6 o'clock and some of the things that Kelly and Desiree are going to be sharing. So I will, again, give that pregnant pause and then we'll go on from there.
All right, absolutely. Looks like Elizabeth put it in there, but I'll stick it in there too. So it's at the bottom there.
Oh, great.
My email.
So it looks like Mitchell asked the question, when getting started with terminology, how is it best to spread it to other faculty?
So, most people aren't going to care about everything in the dictionary, but anything you're using in your program, I would share. And you can literally just link straight to it, either on the AHRQ website or on SSH dictionary website. On AHRQs, you can download a PDF as well, but either one works. And sometimes I'll highlight it. Sometimes I'll just take a snapshot of it and send it out. When we're in the middle of doing simulation design is a great time to impart that knowledge or say, oh, here's the definition, or you can use this definition in your publication, or, oh, you should write it up and share it with the students. So I really come at it I'm never teaching, oh, that's the wrong definition, never anything like that. But I'm like, oh my gosh, well, which one of these do you mean? So I actually have a copy on the top of my desk. When I recorded that video, I've just pulled all my little resources down. But so when we're doing design process, it makes it fun because then it means something. And we share it and we say, hey, if you're doing any simulation research, we'll share the link and say, and if, so those that are interested in it, you can share it directly. But I would tell you, just relate it to what you're doing, relate it to what you need in your program, and providing clarification for anything you're teaching a hospital or academics. And then it really works. And I always encourage people to write up what they're doing. And that's another thing. And then I'll provide them a copy of the dictionary typically, because non-simulation specialists, right, do not even know that exists. And if they're just piloting something in their courses or designing something new or doing an educational intervention, then they really need those definitions, and you've actually provided them a service.
Great. Anyone else? All right. Well, it looks like you've answered a lot of people's questions. And again, I want to just say from my perspective, I really appreciate all of the hard work and energy that went into this, because we were just focused on writing standards best practice for standardized participants or standardized patients or simulated participants. And it was a lot of work. So to do it for the entire simulation world or industry, that's a big undertaking. And I appreciate that labor of love that you have. So I just want to tease out what they're going to be doing tonight. But I do want to say first that I appreciate all of the work that Lori, Kelly, and Desiree have put into moving the simulation profession forward and really having this long-term impact that is going to change the way that healthcare is delivered into the coming, century. And I always feel like whenever I'm presenting, I'm always standing on the shoulders of giants like you guys. So thank you, Lori, for your work. And
We are
for
too.
all
We're
of the-
standing on the shoulders of all those that came before us, but
Yeah,
it's amazing. And each of you can come in. We'll be happy to train everyone on each of these things so that it will last way past us.
Yes, absolutely. I agree with you 100% on that. The more the merrier, for sure. All right, well, let's take a minute and ask Kelly if she'd come on and just talk a little bit about what's going to happen tonight to get everybody excited for that 6 p.m. interaction.
Hello, good morning, evening, or afternoon, depending on where you are. So yes, this afternoon at 6 p.m. Eastern time, Desiree and myself will be presenting on simulation and DEI. Can we talk? It's just a casual conversation, and we will also have a question and answer afterwards. And I also want to add at 6:30, right after that presentation, we will be announcing the winners of the video contest. So we hope you all join us today. Again, at 6 p.m. Eastern, the link has been put in the chat box, and we hope to see you tonight.
Y'all have a great simulation week. Bye-bye.
Healthcare Simulation Week. Thank you.